Are you worried that you're losing your memory or maybe getting dementia? Forgetting names, appointments, or even familiar places can be unsettling. In some cases, it may be the beginning of dementia, but in many others, the cause is something that can be reversed. I'm Dr. Adam Barron, and in this video, I'll walk you through some of the most common, treatable, and reversible causes of memory loss. Your brain needs nutrients to function. One of the most important is vitamin B12. Low B12 can cause confusion, memory loss, even mood changes. Vitamin B12 deficiency is more common in older adults, vegans, and people with digestive issues like celiac or Crohn's disease. A simple blood test can be checked. If levels are low, B12 can be supplemented with pills, tablets that dissolve under the tongue, or injections. Lower vitamin D and folate levels have been associated with slower cognitive functioning and memory loss. Folate, or vitamin B9, is important in the production of brain chemicals called serotonin, dopamine, and acetylcholine. These help carry messages between nerve cells in your brain and entire nervous system. Low folate may lead to brain fog or trouble concentrating, especially in older adults. These low levels can happen in particular if you drink excessive alcohol, take certain medications, or have poor nutrition. Also, iron deficiency can contribute to memory loss. Iron is essential for oxygen delivery to the brain, and without enough, your mental clarity can suffer. This is especially important to check in menstruating women or anyone with chronic blood loss. Another big cause of reversible memory loss is the lack of sleep. Your brain processes and consolidates memories while you sleep. If you're not getting enough quality sleep, your memory suffers. This could be from staying up late, having insomnia, or even sleep disorders like sleep apnea. Sleep apnea is a medical condition that people often don't even know that they have. In obstructive sleep apnea, the muscles at the back of the throat relax too much and temporarily narrows the airway. This causes airflow to the lungs to be briefly blocked throughout the night. This causes small awakenings throughout the night, but you don't realize it. That causes memory loss. If you wake up exhausted, snore loudly, or feel foggy during the day, it's worth getting a sleep study. Fixing your sleep can do wonders for your memory. Another reversible cause of memory loss is medications. Some drugs can affect memory, especially in older adults. Some common medications include sleeping pills, anti-anxiety medications, certain antihistamines or allergy medications, medications for bladder control, and some blood pressure medications such as beta blockers and clonidine. Also, diuretics may lower sodium and potassium and cause confusion and forgetfulness. If you've started forgetting things after a medication change, bring it up with your doctor. Your thyroid regulates your metabolism, and when it's underactive, you have hypothyroidism. This causes your body and brain to slow down. In addition to symptoms such as constipation, weight gain, and cold intolerance, you might feel forgetful and sluggish. The memory symptoms from hypothyroidism can be completely reversed with the right thyroid hormone replacement. There are common blood tests to check your levels, and there is good treatment. A lot of women going through midlife describe something called menopause brain. It is that foggy feeling with forgetfulness or trouble focusing. This doesn't mean anything is wrong with your brain, but can be part of the transition into menopause. These symptoms usually start during perimenopause. These are the years leading up to menopause, when estrogen levels begin to fluctuate. The brain is very sensitive to these estrogen changes. For most women, this brain fog doesn't last forever. It often improves within a year or two after menopause, once hormone levels settle. If the symptoms are more severe or interfere with daily life, there are ways to manage it, including hormone therapy, sleep improvements, and nutrition. One of the most common causes is chronic stress and anxiety. When your brain is constantly in fight or flight mode, it becomes harder to concentrate and retain information. People with anxiety often describe feeling foggy or forgetful. This isn't early Alzheimer's. It's your brain being overwhelmed. The good news is that memory usually improves when stress is better managed through therapy, exercise, meditation, or sometimes medication. Certain infections, especially urinary tract infections in older adults, can cause confusion or memory changes that seem sudden. In younger people, a urinary tract infection just might cause burning or urgency. But in older adults, you might see sudden confusion, agitation, or even hallucinations. and this can occur without any fever or pain. This is because the infection triggers inflammation in the body, and this inflammation can affect the brain. Fortunately, once the infection is treated, the memory and thinking usually return to normal. Now let's talk about metabolic causes. These are imbalances in the body's chemistry that can affect brain function. One common cause is a low blood sodium level. This can cause confusion, fatigue, and memory problems. This can happen from certain medications like diuretics, from drinking too much water, or from chronic illnesses. Dehydration is another cause. When the body doesn't have enough fluids, blood pressure drops and the blood circulation to the brain drops. Even mild dehydration can lead to mental slowness, especially in older adults. Liver disease and kidney dysfunction can also affect how clearly you think. When these organs aren't filtering toxins properly, waste products can build up in the blood and affect the brain. These can cause forgetfulness, confusion, or even personality changes. And don't forget about blood sugar. Both high and low blood sugar levels can impact memory and attention. High blood sugar levels can affect how brain cells communicate, and chronically high sugar levels can increase inflammation in the brain. Both of these reasons can cause memory loss and brain fog. People with poorly controlled diabetes often have memory improvement once blood sugar levels are consistently better controlled. Low blood sugar causes the brain to be starved of fuel, which can cause memory loss. Most of us have experienced a lack of mental sharpness when we have not eaten for a while. In most of these situations and conditions, when the underlying condition is treated, memory usually improves. Next is depression, which can mimic dementia so closely that it's sometimes called pseudodementia. People with depression often report trouble with attention, focus, and short-term memory. Depression can cause you to feel mentally slow, even if you're not feeling sad. But unlike dementia, these symptoms can improve dramatically with the right treatment. So if you've noticed memory problems along with low energy, poor sleep, or loss of interest in things you used to enjoy, it's worth talking to your doctor to see if you have depression. Memory loss can be scary, but not all memory problems means Alzheimer's. Many causes are treatable, even reversible. If you or someone you love is noticing changes, don't jump to worst case scenarios. Talk to a doctor, get evaluated, and look for things we can fix. Thanks for watching. Please leave a like and subscribe for more doctor health content. This video is for educational purposes only and is not medical advice. If this video helped you, share it with someone who may benefit.